to put yourself first, right? We have infectious disease physician, Dr. Payal Patel. Now, Dr. Patel, you know it's hard to put yourself first, especially when you have so many responsibilities, not only to those around you, but perhaps just to everyone, right? Talk about why it's important to put yourself first and how you were able to do that. Briefly tell us about your journey.
Yeah, definitely. I think, it's really important to think about this. You don't have to think about it as, for the year or for your life. If you do it day by day, hour by hour, if you're helping to take care of yourself as a physician, I know that I'm going to give better care to my patients. And so it trickles down all around you to your family and everyone around you. And so, I think healthcare workers have definitely been in a bind the last 2 years. But I know that going through the pandemic in different ways, mothers and fathers, brothers and sisters and grandparents and being away from family. So, I think as we think about moving on and forward through the pandemic, we're really thinking about how do we take care of ourselves so that we can take care of each other.
Yeah. All right, so I want to actually read an excerpt from the article. It reads, quote, as Black women, we're not often given much wiggle room in terms of who or what we choose to be. I felt like I had to choose, either be a wife, a mother, or a physician or an entrepreneur. Now, you didn't write this article, but talk about, as a physician, do you feel like you also have to juggle several hats?
Yeah, think this is a great article by Dr. Blackstock, and she really goes through kind of all different hats that she wears, now and was wearing when she was struggling with some of these decisions that she made. And yeah, I think, in academic medicine, which she talks a lot about in her article, you always think of yourself, trying to get to that next phase, and everyone has different, barriers, and it can be hard from a day to day. So I think, this article really helped, someone think about what is happiness at the end of the day? What do you need to do to get there? And again, it's important because we, especially physicians, need that to make sure that we're giving the best care that we can to our patients. And so, myself, I think about myself as a mother, female, Asian American, female, all of those things together, in my daily practice. And I try to, be kind to myself and others who are thinking about similar things in their career as well.
Yeah, well, Dr. Patel, I want to ask you, what is the first step to breaking those, I guess they become norms for you, especially if you're raised to put the needs of others before yours? How do you take a stance and say, I'm going to do me, I'm going to put me first?
I think that might be one small thing that has come out of the pandemic. I think many of us were, in a rat race before whatever our career. And we've really had to kind of change how we think about everything in this last 2 years, right? And so I think, beginning with that grace for yourself, whether it's something small like, doing Peloton in the morning or exercising and getting in a little bit late, or taking that conference call with your video camera off, and giving yourself that grace. I think we've all started doing that in this last 2 years, and we don't want to forget that as we move forward.
All right, Dr. Patel, always a pleasure. Thank you for your time and your expertise.